What's going on, everybody? Welcome back to my channel. In today's video, we're going to be looking at 3 exercises to help with knee valgus, or some of you might think of it as a knock-kneed position. So if you notice that when you're standing and performing activities in life, maybe it's sports or other activities, that your knee moves in like this and you have a hard time controlling it, this is called knee valgus, and I'm going to show exercises today that can help improve that position. When we think about knee valgus, there are really 2 types of knee valgus. There's structural and dynamic, and a test you can do on yourself that we'll do in the clinic is to stand with your legs together. Now, normally if people stand with their legs together, there will be a small space right here, like a 2-finger space between their knees when their ankle bones are touching. Now, people with knee valgus, what you'll see with them is that when they stand, their knees actually touch together like this, and they have a space down between their ankles. So if in standing you notice this, then that's probably more of a structural valgus and has to do with the shapes of your bones or maybe severe arthritis in your knees. Most people, if you have structural valgus, the exercises in today's video can still be helpful, but it's probably not going to change it all the way because, again, it has to do with the shapes of your bones or maybe changes inside your knee joint that exercise won't really change. On the flip side, if you have dynamic valgus, that's when people go to perform a squat. So like if you notice when you're squatting, your knees come together, but when you're standing, your bones are pretty straight. Well, that has to do with control in your muscles and really in your hip muscles. So if your knees come together when you squat or when you're standing on one leg, it kind of goes in like that, then that is referred to as dynamic valgus and has more to do with our neuromuscular system. In that case, the exercises are really going to be helpful. So let's jump into the first one. The exercises are going to get more challenging as we work our way through them, so just stick with the ones where you can control your hip and knee well. If you start moving into valgus and you can't control it, then that's probably too challenging for you, and just go back to the previous ones. So the first one here is going to be a double leg squat with a band around our knees. I'll put a link down in the description if you need to get a set of these loop bands. So the band around the knees, when the band is tight, it's going to want to pull us into valgus. So we've got to use our hip muscles, especially our glutes, to pull our femur, this bone, out into abduction and a little bit of external rotation. When people move into valgus, their hip adducts and turns in or internally rotates, so we're going to use the opposite muscles to hold it out. So what you're going to do is push out into the band, thinking about your kneecaps kind of staying over the top of your foot, and then you're going to perform a squat. So you're just going up and down and doing an air squat, and the whole time you're really thinking about don't let your knees come in. Don't let them move into that valgus position. Keep pushing out into the band. And all of these are technically strengthening exercises, so you're going to go for 3 sets of 10 to 15 repetitions. But really, besides gaining strength, we're thinking about training our neuromuscular system, improving our motor control. When it comes to knee valgus, a lot of it is about just teaching your brain and nervous system to control your hip better so that you can maintain this alignment of your leg. Okay, so this is the first exercise, a banded double leg squat. Again, go for 3 sets of 10 to 15 reps. The second exercise is going to get to be a bit more challenging. This one is called a banded fire hydrant. We're going to stand on one leg, which is the harder part, and we're again going to use the band. So this is going to be more of an isometric control type of exercise where you're holding a particular position and then just really working on your control. So I would practice this on both legs, but the leg that you're standing on is technically the one that we're working. So if I'm thinking about my right leg, I'm going to go down into kind of a partial squat. And then what I'm going to do is lift my other leg, and I'm going to move it in and out like this. So as this leg moves out, the band, you can see, wants to pull this leg into valgus. So I have to use those glute muscles again to push out into the band to keep my leg in a neutral alignment. So you're just going back and forth. This will actually be challenging on the leg that's moving and on the leg I'm standing on. You should really feel it in your glutes, in the leg that you're standing on, and you're just going back and forth like that, nice and slow. This will also work your balance. It's going to work, again, that control of your knee joint. I'd encourage you to do it barefoot, really to work on all of those foot muscles as well. If the band is too hard, you can always start just standing. You can just stand like this and just work on your balance and holding your knee position. You can then kind of add the extra movement without the band. So that can be a progression. And then lastly, add the band for even more challenge. But even just standing like this and holding, I can really feel my glutes. So again, the focus is being able to keep your knee controlled so that it's not moving in. If you start noticing that you're moving in, then you've got to go back to the previous level. Okay, so let's go to the next exercise. For the last exercise, we're again going to stand on one leg, but this time we're going to move up and down through sort of like a single leg squat pattern. So this will be more challenging because we're not just holding one position like the last exercise. So this is called a lateral step down. You're going to use a stair at your house or an exercise step like this, and you're going to stand on the edge with the leg that you want to work. So what I'm going to do here, hands up on my pelvis, and then I'm going to squat down really slowly until I touch the heel on my other foot, and then I'm going to come back up. And the whole time here, I'm working on control of this knee. I don't want it to move into that valgus position. It's probably going to wobble a little, and that's okay. But just go down slowly. Think about 3 seconds on the way down and 2 seconds on the way back up. You're touching your heel on the other leg so that you're not tempted to push off with that one. Sometimes if people touch with their toes, they'll kind of push off. So go down, touch with your heel, and come back up. Again, thinking about 3 sets of 10 to 15 repetitions. And the key is to find a step height that's challenging for you, but not too high. So something like this is kind of nice where you can change the level of it to find the right challenge for your current capabilities. So you want something that's probably somewhere in the 6 to 8 inches so you can reach down, touch your heel, and then come back up. And again, I would do all of these on both legs, even if you only notice the valgus on one side. It's good to practice strengthening exercises on the other side as well. Thanks for checking out today's video. I hope you find the exercises to be helpful. If you need another resource that's more comprehensive, if you go into the knee chapter in my book, you will find this patellofemoral pain program. Even though you might not have knee pain, a lot of the exercises that we would do for kneecap pain or IT band syndrome will be ones that can also help with dynamic valgus. So as we go farther in this, you'll see things like the lateral squat walk, side lying hip abduction, the single leg bridge. And as we go in a little farther, these exercises, here's a banded squat like in today's video, the standing hydrant like we did today, a number of exercises that can help with improving strength of the hip muscles and improving leg control so that you have less of that dynamic valgus. My book has programs for the entire body and each body region, so it basically allows you to do your own rehab at home. I'll put an Amazon link for the book down in the description if you want to grab a copy. Thanks again for watching today's video. I'll see you in the next one. Bye.